Okay. Good morning, Karen. How are you today?
Good, how are you?
Good, good. So I did just want to start off by just reviewing the figure storm test that I had you fill out for nicotine dependence. So it looks like for those 5 questions, 6 questions, yes, it looks like you scored an overall 5. So it does look like you have a moderate nicotine dependence. Um, so I just have a few questions that I did want to ask you. So, are you a current smoker?
Yes, I am.
How long have you been smoking for?
Around 5 years.
5 years? Okay, good. Well, not good, but are you actually
Mhm.
interested in quitting?
Yes, I am. I'm really interested.
Have you tried quitting in the past?
I have. I have
Okay.
tried.
What was
Mm.
the hardest part about quitting when you previously tried?
I will say the daily. It was so into my routine that it's kind of hard to just let it go.
Okay, so you were just used to that routine.
Yes.
Um, What kind of tobacco do you use and how many times are you smoking a
I
day, would
use
you say?
cigarettes and I would say like 2 to 3 times a day. Like every time that I eat a meal, after that I light it up and then I smoke.
Okay. Why do you feel personally that you like smoking?
It reduces my stress. Like it helps me do my tasks like a little bit calmer and with a clearer mind.
Okay, okay. Which makes sense. Nicotine is a stimulant, so it does help with like anxiousness. I know that when you probably know from experience from previously trying to quit that when you probably tried to quit, probably caused more anxiousness and the withdrawals of like headaches probably just made it more difficult to follow through. Um, so of course, of course, we want to, when we are doing any counseling, we do want to recommend patients to quit smoking. Do you think that you would be able to quit in the next 30 days?
I will say so. Yeah.
Okay. Um, so typically when we do any type of counseling, we like to give patients a set quit date just so that we can give them something to look forward to. Otherwise, if we don't give them a certain date, then it'll eventually discourage patients from quitting. So I would love to set a quit date. So maybe 30 days from now. So we could set a date for April 8th. Um, if you think that would be a manageable time for you to just prepare yourself mentally to quit,
Yeah,
do you
I
think
think
that would work? Okay.
that date sounds good.
Okay. So
Yes.
typically, um, it's hard to just, well, for some patients, it's easier to quit cold turkey, but for some patients, it is more difficult. So we typically like to recommend nicotine replacement therapy as an option for patients that are quitting or that are looking into quitting. So options that are available are like patches. You could probably get those anywhere too. So like nicotine patches, there are also gums that you can introduce. So, chewing those gums can help with quitting. There are also like lozenges that you can buy. So, that could be something that you could potentially implement if you're struggling. Um, just with that, like, since it is a habit for you, just having that available would help. Of course, we recommend patients quit smoking not only because it leads to many cancers, but it is said to cause 30 to 40% of deaths in the United States yearly. So that's exactly why we want to encourage patients to quit. And it is a modifiable risk factor. So we do like to discuss with patients that it does affect your oral cavity. So it does lead to periodontal disease. So when you consistently smoke, you reduce the amount of blood flow to the tissues in your mouth. And the blood flow is what gives the tissues nutrients. So we just like to remind patients that when you do reduce the nutrients and the blood flow to those tissues, you start to lose bone, and that's not what we want. So, um, let's see. I can definitely also send over some options for quitting. So there are a couple of quit lines that you can call if you ever feel like anxious and ever feel like you need to pick up a cigarette. You can reach out to them, and I'll add all of this onto an email as well. So um, there is the Colorado Quit line. There are also texting programs that I can email over to you. Those are great. So if you ever feel like you don't want to be, if you don't want to talk to anyone on the phone, you can always just shoot them a text and be like, oh, like I'm feeling anxious or like I had a stressful day, and they can help you walk through it so you can avoid smoking. Um, and then I do want to set a date so that we can meet up again after um that quit date. So maybe we could meet like a week after, just so I can check in on you to make sure that you have actually quit and that you're implementing the other resources that I just mentioned. So maybe we could schedule it for maybe the 18th of April, so 10 days
Okay.
after. And I can give
Yeah.
you a call and we can just discuss like any issues that you've been having. And then we can go from there. And I can offer additional resources as well.
Okay.
Okay. Well, thank
Thank
you
you so
so
much.
much. Thank you so much for your time, Karen. I appreciate you.
Thank
Okay.
you.
I'm going to end the call, okay?
Okay.